feed me grow. Last fall was so cold, spitting fire at the show.
Hello everybody, thank you for tuning into my channel. My name is Kiana. I am a registered nurse. I hold my master's in nursing education. If you have watched some of my other videos, you know that I'm in transition from being a floor nurse to becoming a nurse educator. While in limbo, I decided to go ahead and start a ER mini series. I'm going to be describing some of the most common patient situations that occur in the ED. I'm going to share my experience, and then I'm going to give you tips and tricks if you're interested in becoming an ED nurse on how you can better prepare and handle situations similar to the ones that I've experienced.
So I know I look a mess, but I'm going to tell you guys about my very first trauma. So as an ED nurse, depending on what level of trauma center you work in, you will be required to take something called TNCC. Don't ask me what it stands for, but it's something trauma, something. Anyway, so I remember, like, I worked at a level 1 trauma center. I was required to take TNCC. So the night I got my very first trauma on my own, I was so excited. I'm like, okay, I'm about to follow this pathway. I had got fluids ready. I had 2 large bore IVs. I had the monitor, EKG, backboard. I was ready to do everything. So the charge nurse comes in. He's like, are you ready? I'm like, yes, I'm ready. Let's do it. He was like, what are you doing? We have to go get the patient. I'm like, huh? And he was like, yeah, the people are coming in saying there's somebody at the bus stop shot. And I'm like, what? Wait a minute. We gotta go get the patient. On my preparation, I'm looking at the charge nurse and he looking at me, and I'm like, because I used to be in the military, so I'm like, VSI is my safe. I'm not trying to get shot. I'm just trying to help this person. So make a long story short, more people kept coming in oh my God, this guy, he's shot. So he's like, grab the stretcher. So I grabbed the stretcher and I'm running out of the ambulance bay to the bus stop to this patient, and I'm imagining somebody laying on the ground, shot, bleeding out. But lo and behold, it's this man there holding his stomach, smoking a cigarette. And I'm like, sir, are you okay? He was like, calm down. This ain't my first rodeo. Let me smoke a cigarette, because I know once y'all start working on me, I ain't gonna be able to smoke, and I want to finish. And so I'm I'm looking at my charge nurse, because this is my first time ever involved in something like this. I'm like, what do we do? And he's like, you just gotta let him finish smoking. So we're basically standing there with all this equipment, the stretcher, the monitor, and stuff like that. The bus stop is right in front of the hospital, so it's not like we had to go far, but we're just standing there while this guy's bleeding out, and we're just waiting for him to finish smoking. And then after he finished, he just walked over to the stretcher, laid down, and then we went back into the ED and did everything we were supposed to. But nonetheless, I wanted to tell you that story because I think oftentimes we expect our experiences to be like the book, and they're nothing like the book. Every experience is going to be different. You just have to be prepared for whatever, because it can go either way. You just never really know which experience is going to be yours.
So that was my very first trauma experience as a nurse. When you're coming out of nursing school, I think that transition point is a little difficult, because it's who's the nurse? And you're like, I'm the nurse. And they had us say it when we were in nursing school, but how many of us really believed that we were the nurse? And in the emergency room, you're pushed into situations like this almost immediately. And as I mentioned before, working in the ED is a collaborative effort. You have to rely heavily on your coworkers, because they're essentially your team. So in this situation, I really wanted to share my first trauma, because I think I was looking at my book, and I do have it here. So TNCC stands for Trauma Nursing Core Course. So I actually still have it. I keep it handy. I have the old version. I think you have to renew it every 5 years, and I just basically use it as a reference point. Some people still study their textbooks. I like to have references. I don't know if that's part of my PhD education, but I always like to have something to revert back to whenever I have a question about something. And even if I don't have it handy, if I'm in a situation where I can kind of remember something from the book, I'll go back and reference it. So dealing with traumas, you always want to have references. Usually hospitals have algorithms that you follow for trauma alerts, for your assessment, how often you're doing vital signs, and so on and so forth. Like when the patient leaves the floor, they have to know like how long they were in a C-collar, what type of imaging they had, when they got cleared. All these things should be provided for you in a trauma packet. Now, don't skip steps. So there have been times when I have, came in, I may have not been the primary nurse, but I can remember a time when someone was trying to skip the log roll. So in trauma, you want to check patients from head to toe because you really don't know like where you want to look from head to toe to see where the injuries are. If it's a true trauma, you want to address every single injury because a missed injury could be like the cost of that person's life or lead to a decline. So make sure you do the full head to toe and definitely do the log roll. You always want to have shears. Oftentimes, like I said, there's so many levels to trauma. So you'll learn more about this when you go through the course. But in a level 1 trauma, you have this patient, you have to like cut clothes at this point to get this patient completely exposed so that you can see every single injury, address every single injury, circulation, airway, breathing. So definitely do that. Circulation, like if the patient's bleeding, you want to definitely control their bleeding. Chest tubes, especially if you work at a level 1 trauma center, because setting up the drainage system is not something that's like commonly done in lower trauma levels. But in a level 1 trauma center, the doctor's definitely going to ask you to prepare the chest tube system. So you need to know how to set that up. There's some really good videos on YouTube, even I go to watch, get familiar with what type you have in the hospital before you do it. So I hope you have subscribed to my channel, and more importantly, I hope you enjoyed this video. Thank you for watching.